Hi, I'm Amina. I'm going to be your student nurse practitioner today. How are you?
Good, how are you?
Good. I'm just going to ask you a couple questions to get to know you a little bit,
Okay.
and then ask more health-specific questions.
Okay.
What are you here for today?
I'm just mainly for my wellness visit, but I did start having like wrist pain about a week ago, so I don't know if we can look at that.
Okay, yeah. So it started a week ago?
Yes.
Just in your right wrist?
Yes.
Okay. Is it intermittent or constant?
I guess intermittent because it only happens whenever I'm writing or typing.
Okay. So alleviating factors would be just not using it.
Yeah, just rest.
Okay. Have you tried anything for it, like ice, medicine?
No, I haven't.
Okay. And on a scale from 0 to 10, how bad is it?
It's like a 3.
Okay. Well, we'll definitely need a plan for that. But I'm just going to kind of ask you some questions, and then we'll kind of sum up at the end, and I'll address that with your plan of care, okay?
Okay.
All right. So do you have any allergies?
Nope, none.
Okay. Food, drug, medication,
No.
latex?
Nope.
None of that. Okay, great. And what do you do for your profession?
I'm a ICU nurse.
Okay. Do you feel safe at your job?
Yeah.
Any exposures to occupational hazards?
No, I'm pretty good about wearing protection gear, so.
Okay, great. What about your home living situation? Tell me a little bit about that.
It's good. I live with my son. I'm actually divorced, so it's just my son and I, and we live in a house. It's a good
Safe neighborhood?
Yep, safe neighborhood, safe house.
Do you
Oh.
do you have, so you said safe neighborhood, home, do you have like all utilities working?
Yeah, everything's up to date, utilities, like
Do you
the code inspection,
Okay.
fire thingies.
So smoke detectors,
Yes,
fire
detectors.
extinguishers,
Yep.
carbon monoxide.
Yes.
That's important for the little one. Okay, great. And do you have any spiritual, cultural, religious preferences or practices, particularly that will affect your care?
No religious or spiritual practices at all.
Okay. And health maintenance, do you do anything kind of for your physical or mental well-being?
I try to work out maybe once a week or do yoga for just like stress management when my parents can watch my kid.
Okay, great. Do you have any community resources that you use?
Just friends and family. I have a bunch here, so they're pretty great.
Okay, awesome. So you said that you have no drug allergies and no known allergies, correct? Have you had any recent travel outside of the United States?
No, none.
Okay, exposure to anybody that might have communicable diseases, like very contagious diseases?
No.
Awesome. And do you have any major childhood illnesses or adult illnesses or injuries?
The only illness I really had whenever I was a kid, I think I got sick with chicken pox whenever I was 3, so I think like 1994.
Okay.
And then I broke my arm, my left wrist twice in 2000 and 2003. And the last time I broke it, I had to have surgery on it. And then my right elbow, I broke in 2014.
Okay. So I know you just mentioned surgery. Any hospitalizations or surgeries other than what you told me?
Other than the wrist, I was I was hospitalized for my son's birth this year.
Okay. Normal vaginal delivery?
Yep.
Okay. And no complications?
No complications at all.
Any diagnoses during your pregnancy or after?
Nope.
No. Awesome. No other hospitalizations that you know of?
None.
Any blood transfusions or blood products?
No.
Have you ever heard of Rogaine?
Yes. Haven't had it.
No?
Nope.
What do you know your blood type?
O positive.
Fantastic. Most people don't know that. Okay. Any use of alcohol or drugs?
No, I don't drink alcohol, no drugs.
Okay. And have you ever smoked or used tobacco products?
No, never.
Okay, great. And immunizations, are you up to date on those?
Up to date on all of them through work, and I think you guys have a copy. I gave it to the front desk.
Okay, awesome. And are you on any medications?
No medications at all.
Okay. What about caffeine use?
Maybe 1 cup of coffee a day.
Awesome. And so we're going to go into just a little bit of your family history. Tell me about your mom.
So she is alive. She has hyperlipidemia and hypothyroidism.
Okay. And what about your dad?
He just has hypertension.
Okay. Tell me about your mom's parents. So your mom's mom and your mom's dad.
So they're both still alive. My mom, my grandmother, she is pretty healthy. She just has hypertension. And then my grandfather, he's really healthy too, for how old he is. He has hyperlipidemia and hypertension.
Okay. And tell me about your your dad's mom and dad.
So he's technically he is adopted. It's not technically adopted. So we don't know much about his actual parents. But his dad, my grandfather, passed away when he was 84 with prostate cancer, and his mom lung cancer when she was 73.
Okay. So you kind of addressed everybody who's alive and deceased.
Mm-hmm. And then my son, he's healthy. He's 6 months. He doesn't have anything. And then I don't think his dad and I are divorced, and he was healthy. So
okay, awesome. Okay.
Oh, and I didn't even think about. I also have a sister.
Oh,
but she has hyperlipidemia. But other than that, she's healthy.
Okay, well, great. Those are all great things to know. So now I'm going to just kind of ask you some questions specific to your health.
Okay.
We typically go head to toe by body system. Any changes in your hair, skin, or nails?
None.
Pigmentation changes?
Not that I'm aware of.
Okay. Any new moles, lesions, rashes,
Nope.
itching?
Mm-mm.
Nowhere on the body?
No, none.
Fantastic. So I can see that you're wearing glasses. Is that for close up or far away?
It's for close up, and I think I had my last eye exam 6 months ago, and so they're pretty correct.
New prescription?
No, it's the same.
It's the same prescription.
Yes.
Okay,
Yeah. So
but you have seen the doctor.
Yes,
the eye doctor.
Yes.
Okay, fantastic. How are you feeling overall with your health?
Good. It's good.
Okay. Any flu-like symptoms like fevers, chills, body aches, night sweats?
No, none of that.
Okay, great. And how is so no changes in vision?
No.
Right? Okay, so no double vision, no flashing lights, light sensitivity.
Mm-mm.
Okay. And with your hearing, how's that doing?
My hearing's great. I haven't ever had any issues with it, thankfully.
Okay, great. Any issues with your equilibrium?
No dizziness, no lightheadedness, anything.
Okay. And any headaches, head trauma, any trauma to the head, neck, face, anything like that?
None.
Okay, awesome. And you already mentioned surgeries, any changes in smell?
No.
Okay. And do you have all of your teeth?
Yes, I do. I still have my wisdom teeth, but they're not in.
Okay. And when was the last time you saw the dentist?
I think about 6 months ago too.
Perfect. And did you get a regular checkup, x-rays, and cleaning?
Yes.
Perfect. Any sores in the mouth or on the tongue or under the tongue?
Nope.
No pain in your mouth?
Nope. It's pretty.
No pain in the head, sinuses?
No, none. And no
lymph nodes?
Nope. No
Okay.
pain, tenderness.
Okay.
Haven't noticed anything movable.
Great. So your thyroid, I can't really see anything. So any thyroid disease in the family?
Just my mom. I thought my
You
mom
did
has
say that.
yes, she has hypothyroidism, but
Okay.
I haven't been diagnosed with that.
Okay. Any heat or cold intolerance?
No, I've been fine.
How's your energy level?
It's good.
Okay. Awesome. And do you have so we'll just keep moving down, any issues with difficulty breathing?
No, I haven't ever had any.
Okay. No issues with the lungs or difficulty breathing while you exercise?
None.
Okay. And what about your heart? Do you have any pain in your chest ever?
No chest pain. No, I have a regular heart rate from what I'm aware of. No high blood pressure. It's pretty low, actually.
Okay, so I know with your family's history, you've never been diagnosed with high blood pressure or hyperlipidemia, so
nope.
High cholesterol.
Mm-mm.
Okay, awesome. Okay, and any bleeding of the gums or abnormal bleeding or bruising anywhere on the body?
No, none.
Okay, fantastic. And how do you feel with your diet?
It's good. It's good. I try not to eat super processed foods. I try to get 2 to 3 meals in a day. I think I have caffeine occasionally.
Okay.
But I don't drink alcohol or anything.
Okay. So yeah, I think you mentioned that no alcohol or drug use. So perfect. And never a smoker. Fantastic. So if do you have any issues with your bowels?
None. No.
Like stomach aches?
No bloating normally.
Bloating. Do you have a bowel? How frequently do you have a bowel movement?
About once a day.
Okay. Awesome. And that's normal for you?
Yes.
Okay, great. So lots of fruits and veggies.
Try to.
Do you take any supplements or vitamins?
No, none.
No. Okay. I know you said no medications, but we just like to make sure. Any herbals or teas?
No.
Okay. Awesome. Any issues with your bladder? Any frequency? You're dribbling?
No, and I don't have any incontinence issues or anything after the baby.
Okay, great. So no dribbling. Perfect.
Yeah.
And do you have any pain, itching, burning when you urinate?
No, none.
Perfect. No like pain in your back or
not that I've noticed, no.
Okay, great. And is your urine generally describe your urine to me. Is it clear? Is it yellow?
It's clear, yellowish, no odor.
Okay, great. How much water do you drink every day? At least
as much as I can get.
Okay, great.
Maybe a liter to 2 liters.
Okay, great. That's fantastic. So moving on to your female reproductive organs.
Mm-hmm.
Any changes in the breasts?
None at
Discharge?
all. No discharge.
Okay. And did you breastfeed?
No, I did not.
Okay, good to know. And when was your last menstrual period?
I think maybe on September 1st or 2nd.
Okay. How long does it last?
Typically 5 days.
Do you have one every month?
Yes, every month. I'm pretty regular. And it's pretty normal. Like, it's not super bleeding. It's not painful or anything.
Okay, great. So no heavy bleeding, no saturating through a tampon and pad?
No.
And out. Okay, great. And you said your son, is that your only pregnancy?
Yes, only pregnancy.
Okay, great. Any issues or complications or diagnoses?
With that, no. I was super healthy, thankfully, during it.
You said vaginal delivery,
yes,
right?
Vaginal.
In the hospital. And, okay, great. How is your libido?
Good.
Okay. Do you practice, or what do you use for contraception?
Just condoms.
Condoms? Perfect. That's great. Do you use latex condoms?
I think so.
Okay. All right. Good to know. Do you have any issues with range of motion? Any musculoskeletal pain?
No, I've been doing yoga, and I haven't noticed anything with that. And it's actually helping a lot with flexibility and stuff.
Okay. Awesome. And so overall, how do you feel with your mental health? Pretty good.
A little stressed with school, but it's manageable, especially with the yoga and everything.
Okay, great. Any issues with numbness or tingling anywhere in the body?
No, none.
And you said no changes in your speech?
Nope.
Everything's pretty normal.
Yeah, or appropriate.
Awesome. And no swelling in your extremities?
None. No, I've never noticed any swelling or
maybe during the pregnancy.
Maybe during pregnancy. Everything was big.
Oh yes, I remember those days.
I'm trying to think if there's anything that I didn't tell you.
Yeah.
Everything's moving well.
Feel good.
No headaches. Yeah.
Okay. And so just no thoughts of harming yourself or others?
None.
And okay. Great. Well, we will get you a plan for your wrist.
Okay, thank you.
And if there's nothing else to add, it was nice to meet you, and I hope you have a great day.
Thank you. I can't see my boobs.
Oh, God.
When it stopped.